Hej och välkomna till Skönhetsbyggarna. Här befinner Thomas och jag mig i vackra Costa Rica. Vi är på Establishment Labs och vi ska ha en intressant diskussion här med två väldigt viktiga personer för företaget och gå igenom lite deras filosofi. So, today we will speak English and with me today, or with us today, we have JJ Chacón, founder and CEO of Establishment Labs, and Roberto, who is the CTO, Chief Technical Officer of this company. So, can you just tell me a little bit about your background? What made you come into this business?
So, I actually come from a family of plastic surgeons, and like every son of a plastic surgeon, I was supposed to be a plastic surgeon, but I never wanted to do that. I was trained as an economist. And eventually, through the exposure to my family's, practice, I became acquainted with the problems of the industry, and I decided to found Establishment Labs in 2004. And I'm the founder and CEO.
And that's interesting. What were the problems of the industry?
Well, I think that anyone who's interested in breast aesthetics, breast reconstruction, because they've had breast cancer before, understands when they read, the internet, that these things have a history. The number one search in Google is, for breast implants is, are breast implants safe? So that tells you everything. So I thought we can fix the legacy of the industry if we put a woman's health angle to it, because then all the decisions that you make are to solve the problems related to safety, objectification, not the type of outcomes that a lot of women expect. So that's what we've been doing.
Okay, and you, Roberto, what is your background?
Yes, I am engineering. I have an engineering background, and I've been working in the medical device medtech industry for many years. And I was part of big companies that sometimes they are slower in making new things. So when I met JJ and all the ideas that JJ had, I was very thrilled that a lot of the things that he was thinking that can be, more beneficial for patients, it was totally doable. So that's when we and another couple of engineers started working with JJ in order to bring to life all these concepts and ideas. So that's how I got involved in this journey.
Mm-hmm. And you don't have a medical background?
No medical background. My dad is a medical doctor, but yeah, I didn't follow those same steps. So,
and that is, I think, what we think is interesting also, that the translation from engineering ideas, philosophies, and all the way to through research and to the OR, that process is something that we will discuss a little bit today, because I think that most patients are not really aware of how much it takes to go from that idea that you guys had and then actually have the implant in the OR. But can you just tell us a little bit about the products that Establishment Labs have?
So I think it's very important to understand that the way we created the current generations of technologies that we have was not by looking at them as products, but as solutions. And to create solutions, you have to create technologies that can support that. So, for instance, surface technology. When we started thinking about remaking breast implants from the ground up, we said, well, one of the biggest problems is surface. And, we created a different type of surface, and that technology has transformed the way we think about biocompatibility. Then, the chemistry, thinking about the foundation of the implant to prevent, ruptures and, other problems, and seeing this from a completely different chemical, physical, point of view, that creates a different technology. And then with time, we added RFID to the implants. That's a different technology. And in time, we've been just adding all of these. And when you look at our current, latest generation of products, is based on that architecture. And I think, one of the best things Roberto did early on was to create a patient risk-benefit analysis that basically supports all of our decisions. So, it's very nice to look at it like this, because then when you see a product, you understand they've created all these underlying technologies that support it from safety and also aesthetic perspective.
Mm-hmm.
Yeah, maybe just to add to what JJ just said is, we needed to understand very well what was out there in order to improve the technologies. And JJ was very keen always on putting anything that we were doing, the woman had to be in the middle of it. And actually in this building, and by the way, welcome to this building. We're very happy to have you here.
Thank you.
But this represents what we have in here. I don't know if you can see it on the camera, but so we have a woman representing that is in the middle of the heart of creation that we call Sulàyöm Innovation Campus, where we are. And that has been since the very beginning something that JJ inspired us. And then to develop those solutions, it is important to understand very well what are the things that are not working well. And as we had that benefit of getting with people that knew about all these issues and start building that platform of architectural development that led us into a comprehensive products that we start putting together. And I like to say this, but we are a company, we don't sell breast implants. We sell experiences and solutions that are more integrated for specific needs. And we have been very carefully identifying what are the things that really adds value to the patient. In many times, I came to JJ with JJ, this is a product that is way better than the product. I remember for the breast reconstruction, we created a tissue expander that already had the surface, the benefits of the surface, the more comfortable, but there was still a magnet there. And then when we realized that still was going to be a limitation on the breast reconstruction in terms of MRIs or any other imaging, JJ pretty much told us, no, this is not going anywhere. Let's go back to the drawings and start again. And that's when we leveraged the RF platform in order to get rid of the magnet and metals and have a product that breaks the limitations that product around breast implants had, just because no one asked enough questions about how to fix them.
But you have gone from medical technology to something you called female technology, femtech. And how did that come? That's okay, that's technology, but there is also philosophy or something. How did you come to how did you explore the women's needs? Who did you talk to? Was it social? That is something more soft than technology.
Yeah. No, I think that's a key point, because here we are, 4 men talking about technology that is used by women, and and I think people that listen to this can say, well, here you have 4 guys telling us what to do, and I think femtech liberates you from that. Because you don't have to be a genetic female to understand that this term femtech, technology that improves women's lives. If you think about it, it's not only about the health part, the safety of the devices that we create is the other part that is even more important, the wellness that it can bring. Because most of the time, and even in breast reconstruction, it is elective. You elect to have it. So you better convince me that you've taken into account, what I really would like to see there. And you see in the progression of our technologies how we've gotten better and better at this. So, our latest generation is something that, was based on market research done, globally, focus groups, ethnographic, I want to see what's in your closet, show it to me so I understand why you're not wearing this type of clothing, why, you're not doing certain activities that you would like to do. And once you put that into the inputs of the design process, you start designing experiences because you realize your products are liberating certain aspects of a woman's life. At the same time, femtech allows you to understand the limitations. We cannot, make somebody happier. That is in them, but we can make their life easier, more convenient, more beautiful in a way. But it is for them to undertake everything else. And like this, we create a very, I would say, safe environment for us to be able to provide what people expect from us.
Yeah. And you create these devices we have for the whole world, or is it just the European market, or how do you sell it all over?
So we sell basically all over the world. We are now in more than 90 countries, presently commercializing. And, you'd have different paths from a regulatory perspective. We've been in Europe now since 2011, with different technologies, different generations of our, product families. And lately, we opened the Chinese market, which took some time. And now we just got clearance for our Flora tissue expander in the United States, and we are waiting approval for the, implants. That should happen later this year. So basically, very global in terms of the footprint, but we manufacture, design right here at headquarters in Costa Rica.
So you have interesting insights to different cultures. What countries want to have like bigger breasts, or like other countries maybe want to have very discrete results? Do you experience like that?
Differences like that? Yes, actually, if you look at something like the Japanese market, in the Japanese market, you will say women in general look for more discrete things, but not all of them. And then when you look at the European market, people tend to think about what they see. If they see somebody who's done big volume, they automatically think, oh, they have breast implants. But sometimes if they see someone who's, part of our Joy program, that, creates a very natural movement of the implant, feeling that is different, more like real breast tissue, and a size that is harmonious with their body, they're just going to say, oh, what a beautiful woman. They're not going to say, oh, she has breast implants. And I think that's what we want to get to, is to a place where women understand better those choices, and the plastic surgeons can guide them to make, those choices.
Okay. So also, like in the European market, we think that we know what the women want there, but we only know the stuff that the people who come to us as plastic surgeons, we know what they want, or at least they think what they think they want. But there is also women that never go to the plastic surgeon because they have the idea that, this is too big for me. This is I don't feel comfortable with this environment. You have tried to address that.
Oh yes, definitely, and we've been working on this for many years. If you think about like what we are doing with our minimally invasive platform, we created minimally invasive for many reasons that we can talk about. But one of the most important ones is because we thought that there's this large group of women who are using padded bras, push-up bras, that are making decisions on what clothing to wear, what clothing not to wear. And when they see the current, view of what breast aesthetics can give to them, they say, well, that's not for me. And I think it's now on us, now that we have created this technology, to tell them, no, there is something for you. And this is safe, very convenient, and has good aesthetic results. And it's very different. So it's going to open up a market that has never been keen to exploring with the plastic surgeons, how to better get those results.
I think that there has been a very important progress on all these different technologies that JJ is speaking about. The other day we were opening a clinic here in Costa Rica, and a patient had a procedure 1 or 2 years ago, and she was in the stage there, and when she was talking about her experience, she said, I don't know what you guys are talking about. I feel that I was born like this. And that kind of testimonial for us are very important, because that's us understanding those needs that JJ is saying, and how we're creating the technologies in order, at the end it's a choice, this is a woman's choice, but like to have products that don't have an impact on your daily lives, that it's more natural, that it's more dynamic, that it will not disrupt what you like to do. And then you can have this procedure and go back to what you like to do fast. It is something that really makes a huge difference. So creating these kind of technologies, and it, again, it's not only a product, it is more the whole experience. It allows us to get to those needs that patient has that maybe you will never get it in your OR, on your consultation, because it will be patients that will never get to that point because that's not what they're looking for.
No, exactly.
So in plastic surgery, we have like two different fields when we talk about implants. It's reconstructive, after cancer surgery, and then we have the aesthetics. Thomas and me, we are generally working, or almost only working, with the aesthetic patients. But I was thinking, like Formula One, they develop the cars, they explore all the technologies, and then they translate that to making more ordinary cars. What is the Formula One of breast aesthetics here? Is it the aesthetic part that will help you to develop the reconstructive part? Or is it the other way around, that the reconstructive is the base for then moving into what is the aesthetic important thing?
Yes, I think this is a key aspect of how we design. Because, when you think about the journey of women in breast reconstruction, it is different from the journey of women in breast aesthetics, but there's an underlying journey, and is the journey of breast health. So if we can teach women early on that breast health is important to them, and that breast health also encompasses understanding that you have options for aesthetics should you choose to do something, and eventually should you be one of the 7 women in the world that, in average have eventually a breast cancer, unfortunately, that there are options as well. And what we have done now for several years is change breast reconstruction in what we called aesthetic breast recon. And that concept has really empowered our team to create the next generation of femtech solutions, like, things that give women who unfortunately have had breast cancer the opportunity to have a treatment in their breast recon that is very close to the aesthetic ideals to which women in breast aesthetic, indications aspire to. And that really changes the map, because we believe in the democratization of breast reconstruction. And we think a lot of women choose not to have a breast reconstruction because they say, the quality that I've seen and the number of complications is just too high. I don't want to go through that. I've already survived breast cancer. Now you're going to make me go through this. So by joining both of those indications into this idea of breast health, I think it gives a little bit more space for women to start thinking earlier, and then what could happen over time. Now, I'll give you an example with minimally invasive. Mia Femtech was created first for aesthetics, for this group of women who are not happy with their breast size or shape, but are not interested in traditional breast augmentation. Now, we are moving that, because of that, into the world of preservation breast procedures. And we can use that in, mastopexies. And, next week we are doing our first minimally invasive Mia breast reconstructions in Paris. So when you create these technology platforms, eventually with the plastic surgeons, because they are so creative, they have so much experience, then you start realizing we can do so much more with them.
So you're basically always driving a Formula One car then, no matter what it is.
Yeah, no, I like your question, because it is the way that we set our technology to push then the limit. So I like that comparison that you're doing, but yes, as JJ said, like, once we understand that the development of the technologies and the scope that they can have, then we start exploring like breast reconstruction. JJ has been pushing a lot aesthetic breast reconstruction, which for us it's a game changer in the way that breast reconstruction is being done, and also other areas that can be get the benefits of the technology to put in place. So yeah, I absolutely like, because that's the way that we're always thinking about.
And I understand that it took some years when you started the company before you put the first implant on the market, 5-6 years or something like that. So it tells me it takes a lot of work and research and thinking during that period of time, which is quite a long time. And then can you just guide us a little bit through that process? What does...
Yeah,
for people who don't know anything.
I think Roberto can give you a good understanding of how much it takes to get to market, but also, once we are manufacturing, the steps that we take to maintain always the type of quality that women deserve. But, when I founded the company in 2004, it took us more than 6 years to put the first product in the market. If you think about Mia, it took us 10 years to put that product in the market. In terms of the tissue expander, it must have been like 7-8 years of hard work. So, it's innovation based on a lot of failures over time to eventually get to a place where we feel comfortable putting this inside a woman.
Yeah, medical devices, it's tricky, right? Because at the end, your products are going to be, in the human body, and so the regulatory scrutiny, it's a challenge sometimes, and that's why sometimes you see so much low innovation in many areas. Like when we came into this industry, the innovations were very minimal because the regulatory challenges, made the companies pretty much do the least amount of efforts. And one of the things that we had was like, if it adds value, if we believe that it really makes a difference, let's push it. And when you are bringing new technologies and when you're innovating, it's not an easy road. We have all the challenges, right? Like, and sometimes they were asking like, but if you guys can just do it like the others, like it would be an easier process. We're like, we're not gonna give up on this. Like, we do believe that this is better for patients. And so it could have been easier just copying other companies or other technologies, but we decided to go the rough way. And I think now all that effort is paying off because it puts us in a situation that it's an innovation that is not going to stop.
And now we're talking about not breast augmentation, we're talking about breast harmonization. Can you explain a little bit about that?
Well, going back to that group of women who are not entirely happy with breast size or shape, and I'll give you some examples of that. Women when they're in their teenage years, they see some of their other female friends developing breast, and some of them just eventually say, "I think that's it. I'm not going to have much more than this." And eventually they ask themselves, "Can I do something about this?" And most of the time it's like, well, there's not really a good option. Then you have women who, don't really care about that. And then later on say, well, you know what? When I have my period, my breasts get bigger and I actually like that. And then they say, yeah, but what's my option? Then further in life, you actually have women who have a, nice breast in terms of volume and they feel good with that, but they have a couple of pregnancies and then they lose volume in, the upper part and they want to regain that. And again, they say, now I have kids. I don't want a general anesthesia. I really don't think I'm going to have to be in a situation to do something about this. So Mia was done in a way that we can give options to these three types of women, provide them, the convenience of it. And the convenience, I think, is based on the fact that we went minimally invasive. Minimally invasive has transformed many surgical practices. If you think about if you have a knee problem, would you do an open knee surgery? Most likely not. You'd rather, have pain or discomfort for many years. And if they tell you, well, it's arthroscopic, you're going to be walking the same day, in 3 days you're going to be exercising, then most people say, of course. And now if you go see one of these arthroscopic surgeons, most likely they'll operate on you. They'll always find something that is not exactly right. So it tells you the power of minimally invasive. So first thing we did is we went minimally invasive because we wanted to do something simple. Take away general anesthesia, the operating time to be very short, and a very fast recovery. So our team created this set of tools so that we could achieve that. You know, a balloon to create the space, an injector to put the implant, you know, through a very simple delivery. But to inject an implant means that you need to have an implant that is injectable. And to have an implant that is injectable, you need to have a new type of chemistry of silicones. So they created the super silicones to be able to get us there. So much work went into that. But eventually we realized, because we're not cutting, remember with Mia, we're coming through a very small incision in the axilla. And a scalpel never touches your breast. We never cut. We are moving tissue with a soft balloon. And then we are injecting a diamond-shaped implant with a different type of chemistry. And that is creating this amazing, elegant results that, you know, are surprising us also in the way that the indication has broadened. At first, it was these groups that I'm telling you about. Now we are seeing women who had, you know, like a need for a pexy and are getting nice results also with Mia. So all of this together is what technology does. You create it with a very specific, you know, intention. In our case, we saw the problem in Japan. Japanese women stopped doing breast augmentation and started doing injections of hydrogels, hyaluronic acid in the breast. Eventually that was banned because it's not safe. But we thought, why are they doing this? Japanese women are smart, they're good consumers, and it's just, they just did not want the old ways anymore. And we said, eventually that could happen worldwide. And that was the creation of Mia. And now a decade later, we understand it is so much more than that.
It's very nice to have a transition from the hyaluronic acid to the implant and have a small implant that is safe and that you can inject.
Yes.
It's a beautiful solution. And I put in like lots of traditional implants, and I felt often that I wanted to make a smaller scar with the traditional implants. If you try to push it in, you can break the gel in the implant, so you can break the implant, and you can also get some friction damage to the skin when you try to push it in. And yeah, then we try to hide the scar in the axilla. We can do that also. But your next step is like, you don't want to do tissue disruption. That is also like a beautiful thing to lift, I think, that many women, they have these different phases in their life. They want to train, exercise, and they want to go to the laundromat, and they want to go to parties and so on. So they have different set of situations, and you offer them now, I think, a very good solution for having it above the muscle, because we like to put it under the muscle because you hide the borders from the implants. But now maybe we can start thinking about not disrupting and damage the muscle.
Yes, and also because of tissue preservation, you are keeping a lot of volume that in traditional breast surgery, you end up losing when you start cutting. And that allows you to have a smaller implant. This implant has a different geometry. So I think for women who are thinking about breast augmentation, sometimes many say, you know what, you end up with very wide breast. And sometimes, you know, I'm moving my arms and I feel like my breast, and that's not comfortable. If I have a kid, I need to lift them, I need to do things. And if I'm physically active, you know, if I'm running, I'm, you know, doing the gym, this can get in the way. So that's the other part where, you know, the convenience is there, is that these things don't get on your way. And I think that's a big also change in the way we think about the geometry and the morphology of the final result, is that women that have Mia look more slender, more elegant. They're, you know, when you look at their torso, the upper part of the torso doesn't look as wide. And I think that helps them create a more elegant, you know, silhouette. And that's also very beautiful, I think, as part of the results that we are doing. Some women actually like the wider breast, and they like that aesthetic. They like side cleavage, they like under cleavage. But for women that are not interested in that, I think this is a beautiful solution to get them there.
And for those women that you were just talking about, we still need to have the more traditional implants available. And I was thinking the implants now, for the audience now that perhaps haven't seen an implant, is that the round implants, they have a flat base and then they are round like this. Will the next generation larger implants be diamond shaped also to take advantage of that geometry?
I think it's a really good question, and I think we can provide that. But already the Ergonomics 2 platform, of which the diamond shaped implant is part, has a round sister that provides for this wider results in which you can have nice side cleavage, under cleavage, and especially very soft. Because when you're using larger implants, you want very soft results. And Ergonomics 2, one of the most beautiful things is that because of the chemistry, and this is again super silicones, then it doesn't create rippling, while at the same time creates a very soft result. And it's because of the surface tension of the shell allows for that. So it adapts very nicely. I think the best way to think about it is it has a lot of adaptability. So at the end, even if you choose a large size, because that's what you want, you can still have a very natural result. And one of the things, we have seen testimonials from women who have the Ergonomics 2 that we sell under the Joy program, is that they say, in secondary procedures, I used to have this, other implant. Now I went to Ergonomics 2 and I'm able to sleep, on my belly. I feel like I can hug my friends and that they don't think I have something in there. It's very different. And they are choosing larger sizes because that's what they wanted.
And and will you make them diamond shaped, you think, in the future? Or?
No, absolutely. Absolutely. I mean, again, when we think about technologies, we want to provide it for women who want, a more discreet look, for women who say, I like looking a certain way that is different. Expression takes that part as well. And we are all in favor of expression. But also, if you think about breast reconstruction, the diamond implant has a place in breast reconstruction. And in breast reconstruction, sometimes you have to recreate a breast that used to be 800 cc's. So you need that type of volume. So in all shapes and sizes, of course.
Okay.
I think we can maybe stop here now, and maybe you can guide us around a little bit in your beautiful facility. Would that be possible?
Yes, of course.
Absolutely.
Okay. Well, thank you so much.
Thank you.
Okay. Very interesting discussion.
Thank you.
Thank you.
So we're here in this great new facility that was inaugurated yesterday. Yes. So thank you for showing this. And please tell us a little bit, what is it that we see here?
So what you see is the Global Learning Center, includes an operating theater. And what we do here is basically design the next generation techniques that will be used by the plastic surgeons with next generation technologies. Because when we give a new technology to a plastic surgeon and we don't have the best technique, then they have to figure it out. So sometimes they have problems because they're, basically learning themselves how to use them. And I think with this, we are going to minimize that process and create better outcomes. Also, I think that there's a need for the team that is creating the technologies to be closer to, women who are having these procedures. So the Learning Center includes, a lot of interactions with women getting a breast augmentation or a breast reconstruction or a breast harmonization, so we can learn very quickly for them, what did you like, what didn't you like, from the experience itself. And then we can give this information to the plastic surgeons. Be careful with this. They don't like this so much. And that is going to help us create a much better environment for women in breast aesthetics and reconstruction.
Yeah, JJ gave me the most interesting job of the whole company, leading research, development, and innovation. And this tells you how serious we are in making things the right way.
Yeah.
We put a lot of our efforts in good science, objective science that can support the development of our technologies. but the clinical part, it's as important. So JJ, since the very beginning, his dad was the first surgeries that I saw after working in medical devices for many years was with JJ's dad. And since then, we learned that being close to the, most updated current surgical practice will help us out understand better the products, because at the end, it's everyone that is involved in, at some point with that product. So having this in our heart of creation tells you how serious we are on making things the right way, not only on the science, but also on the clinical outcomes that we can have. Yesterday, we were having a procedure exploring the boundaries of MIA in a mastopexy, and there was 20 people of my team here. That is a privilege. Our labs are right here on the second floor. So we can have this communication, and this creates a space that allows us for that interactions. And I think I think that it's just going to help us out, continue with our commitment to bring this kind of solutions and technologies.
Yeah, this is a really unique place. This is something I have never seen like this. Okay, we have this in Uppsala, but it's from the 1750 or something. It was a big coliseum with the operation theater. But this is like
thank you.
The fattest thing I've seen.
No, and because we like to do things the right way, so the technology that you see here represents the best technology available now. The equipment, the camera setting, like we can be able to educate.
You can really say that the equipment are like top notch, everything. And
yes,
like,
that's exactly.
And for demonstration surgery to be successful, it's also important with just the cameras, because I think we have attended so many congresses and things like that, and when they have live surgeries and they show on screens and you don't really see what they're doing. So I think what you have done here is really amazing, and it's evident that this will accelerate the possibilities of training and also clinical support for plastic surgeons.
Absolutely. Well, thank you.
Thank you for showing this.
Of course. We can continue now to another area. Amazing. All right. So here we are, the Hall of History. It's always important to keep places like this in order to remind you like where you're coming from, right? So here we have something that is very special for us. When we started learning more about silicones in the lab that we were learning that from, they had one of these in each of the labs for low mix scales. So when we came back from that trip, we went to have a breakfast with JJ at JJ's house, and we said, JJ, man, we need to borrow your equipment here. And so that became our first mixer on the lab. And all the pictures that you see when we started in that JJ's family house, it was with this kitchen in the middle, always like doing all the little batches, and the first prototypes that we built were done in this equipment. And we just gave it. Oh, we never gave it back, actually.
No, you never gave it.
It's here,
but it's now part of history. Of the way we created things.
And your mother is okay with this?
Well, actually, it was not my mother's.
Oh, okay.
It was my wife's.
Oh, your wife's. Okay.
But my parents allowed us to use a couple of rooms in their house when we were doing the first phase of prototyping and things. So we were doing that, and we also, we needed an oven because, to make implants, you need to create heat processes. And at the time, we were doing prototyping so that we could get a first round of investment. And the team found a pizza oven. So that we could do that. So that's also
limited budget, right? So of course, medical grade ovens were not on the option. So yes, we acquired this. That it's a food grade pizza oven, and when we thought, oh, we're going to be fine with this. Then when we started monitoring the temperature, the differences from one tray to another was more than 20 degrees. I was like, oh man, how are we going to do this? But we find the spots, and we were able to create those first prototypes.
So what is the perfect temperature for a perfect implant?
Oh, it depends on the process. There's no perfect temperature.
But precision is very important.
So we had temperature monitoring, a map temperature monitoring of all the sites in order to make sure. But what I can tell you is that makes really good pizzas. We have used it for pizzas. So.
Yes, sometimes for the group. But in general, I think one of the important things is, we were born as entrepreneurs. This company has that entrepreneurial past, but we were always women's health contributors from the beginning. And even now we are in these amazing, one one of the most advanced medical technologies, facilities in the world. But what has not changed is that idea that we are women's health contributors. We have all the technology in the world, but it came from very simple beginnings.
Yeah, it's beautiful to see this. Thank you.
And for how long did you work with the KitchenAid and the pizza oven?
So it was for prototyping.
Yes.
It was for the initial phase. Once we were able to get our first investment in, thanks to those prototypes that we made with this, we were able to move to a full industrial scale, state of the art, everything.
Yes.
And with time, we just made it bigger and bigger, but it was always like state of the art in every single way.
Yeah, you can really tell here.
There was like around a year before then, with that investment that we got from these prototypes, we moved to this same park, but a very little location here. And that's when we started the lab scale of it, but yeah.
And this was back in 2006 or something?
No, this is 2008 when, we were doing this last phase of prototyping that was very important to us.
Wow. Cool. Okay. It's like the heart of the company. You can really tell in every detail you are really working on the culture of the company, and that I think also shows in the end where the product comes out, and that is important in building a company also, I think.
Absolutely.
Yes,
the culture of a company, it's the heart of the company. Like it's at the end, it's people that is making this happen, right? So we're very proud, and we hope that we can maintain that entrepreneurial DNA over the years, so we can continue with this commitment that we have. Yeah.
But it feels like, even if there are many people involved, you're a very good team to fast and adapt new ideas, and you can try stuff, because in a very big operation, corporation, there can sometimes be very slow movements and very difficult to try new stuff, and you can be very movable and
so it's all about keeping a balance between, because we are a global company now, we're publicly traded in, NASDAQ, we're all, the best technology companies in the world are. And all of that should not prevent us from being very close to consumers, to women, patients, to the plastic surgeons, and to innovation. So that's the balance that we need to always be working on, so that we don't lose sight of that idea that we are women's health contributors.
Thank you.
Thank you, guys.
Thank you.
Establishment Lab and the Motiva development, the heart of the Motiva development. And Roberto, please tell me what you do here.
Of course, welcome. So this is one of the most important labs in our entire process, because it is the basics, the foundations. So before things get here, we have a process called design vision. We need to first understand what is it that we want to solve, right? So this goes back and forth with several stakeholders, like patients. Let's say for breast reconstruction, for instance, if we're going to do a product related to breast reconstruction, before even conceptualizing the product, we go to the design vision process. And what are the needs? What are the things that we need to solve? And then we talk to plastic surgeons. So we do focus group with patients, focus group with doctors, surgeons, focus group with your staff members, because sometimes they are the ones that have, a special relationship with their patients. So we try to understand as much as we can in different personas, we call it. And then we move to a phase of research. When we're researching, we start getting some now ideas on how to bring these ideas or concepts to a reality. So then the design lab, it's in charge of putting those ideas into life. So we have access to many different technologies. 3D printing is one that is very, very well used and known, but it's something that helps you see things in a fast way and make decisions on what is next, and also helps you sometimes build stuff. If you need a cutting thing, so you can do a cutter pretty easy here, nice stuff like that. So how to use that technology, I think it accelerates the design thinking process and everything. So just to show you, and actually talking about 3D printing, this is how we have done a demonstration, because when we're going to talk about the science behind our surface, it is not an easy topic. There's immune response cascade that happens every time that any body comes into your strange body comes into your body, right? So So understanding what is that reaction and what is triggering that reaction, it's important. And then we realized that the surfaces that when we started that were out there, they were maybe designed for other reasons. But we came to an agreement with Juan Jose and Salvador and Rolando that we at that time we're starting. It's like we need to make a surface that minimizes that immune response. And that was not an easy challenge, of course. So here it is a surface that is traditional smooth, exists since the first silicone breast implants implanted in the 1962. And these little things are fibroblasts. So you can see here, like fibroblast alignment is very, very immediate reaction because it is a strange surface for them. So like there's an immune response here. Now, the development of breast implants brought textured surfaces. So, purposely done textures in order to maintain products into position, to lock them down like tissue ingrowth and have them into position. But as you can see, the same magnifications, the fibroblasts are there and they don't feel very comfortable there. So we designed a surface which it's at a cell level, it's friendly. And so when cells get here, we create an environment where cells feel not threatened, safe, so the cascade of the immune response minimizes. So silicone, by its natural property, it's an inert material and it is pretty biotolerable. Doesn't mean that it's biocompatible. And adding physical things to the surface can improve the profile of biocompatibility. So it's a combination between the physical properties of a surface and the chemical surfaces that we have other technologies for. Like our implants look a little bluish, and it's because we have a barrier that normally before Motiva, you cannot really see on the implant because the silicone has no color. But so we came up with a way of making sure that important barrier to minimize the diffusion of that silicone gel into the tissue, it's present, and you know, every operator in our production line can know if there's a spot here that doesn't have anything. And it's a result of the process that is it's likely, you know, there's no perfect process. So we need to make sure that we minimize the amount of risk that we bring to the patient.
For quality control.
Quality controls. Yeah. Also here, this is something very interesting. When we started it, okay, so you cannot make a product perfect for every woman, right? So look at this. When I turn it, and I'm going to put it, so you see how different they move?
Yeah.
Can you turn it?
I'm going to do it again here for the camera.
For the camera.
Or here. So you see that one gel, it's going to move faster or deform faster than the other. So this is a gel that we developed for two reasons. The one that moves slower is to maintain an upper pole fullness. So if the patient's desire is to have an upper pole fullness, that's a product that you should use.
So that's for the round implant.
That's the round, the smooth silk round product. And then the other gel, it's more dynamic, more flexible, acts more with gravity. So for a patient that likes more the lower pole expansion and more natural, that's a product that you should be. But then that's not it. That's just the feeling. Then you have to build a shell that you can actually have that happen. So you have to design a shell that is more dynamic for the ergonomics, something that is dynamic but balanced in order to have the round. So that's the whole recipe that we have developed in order to get there.
But would you say that this is also like a gummy bear implant? That is, in the old time we talked about gummy bear implants. Mostly we maybe talked about it around like anatomical implants, but this is also a cohesive, like it doesn't like a fluid.
Exactly.
It just move out. It's if you push it out, if you release the pressure, it will go.
Very important. If you put this gel like this, it's never going to drop. That's cohesive. Like the capacity of a material to stay together. That's the cohesivity of the material. But then we added more things. We call it the rheology map. We measure deformation, stiffness, many other different parameters in order for us to make a more targeted gel. But yeah, cohesive or cohesive, it's just like a flow, no flow thing. If you have a rupture implant, gel should not flow. That should be the standard of all the manufacturers around breast implants. And just to show you a little bit about the future, well, here we have some prototypes of when we decided to remove the metal
for the tissue expander, the breast reconstruction, the second stage that you use a tissue expander after removing the cancer to expand gradually the skin of the breast and then put a permanent implant. So we removed the metal, and the main reason of the metal is because two things. Metals, you cannot do any screening. So if you have a tissue expander with a metal and you need to check your lung because you're having some problems with your lungs or your heart or something, it limits you. Mm-hmm. What doctors do is they remove it and then they do the MRI. But the other thing that is actually more important to us is that dosimetry, the doses that they have to put in every radiation program in order to make sure that cancer is completely gone away. So metal magnets, they have a blow on that radiation. So this material, that what we did was we brought our RF technology, we encapsulated in this medical grade plastic, so no metal, no magnet, and by doing this, we were able to create these port locators that from the outside you can locate the port. Mm. You can see here how things start. This is our first prototype, and this was just a board, very basic, like to start making sure that we were able to locate that. But then this is the first product actually that we got the CE mark on. Mm-hmm. But then we said like, this is not representing in design us, but this made us get there. So then, the evolution of the design now goes to more like a simple tool like this that looks more beautiful and help us out with, it's no battery, but it helped us out find this. And I think that platform in breast reconstruction is going to be playing an important role, not only for breast cancer treatment, but also for the aesthetic results of the breast reconstruction that you can have. And I'm sorry?
Yeah, and for those who are watching that don't really know how a breast expander works, this is important because you are filling this up with saline, and you do that like once a week for a long time, right. And then you come with the needle. It's important that you don't puncture the implant.
Correct.
So you need this tool to locate, and other products have metal in there, but yours don't.
Exactly.
Yes.
And just to finalize here, like this is some prototypes that we have. We created a platform of a radio frequency that is completely passive. And from the outside, let me see if I have a reader here. From the outside, so this sits on the implant. It's very, very small. And from the outside, just by a reader, like a reading, you get an electronic serial number. Mm. This in our industry has been very important because what patients get normally, it's a card with the number. Sometimes they move away from where they were living. Surgeons retire, surgeons move. So, the track record of that, it is important to know what product you have, because if there's suddenly a news on the newspaper that there's a brand related to a specific problem, you want to know what implant you have and take any action on it. So we, since 10 years ago, 2014, we put an RF tag just to show us an electronic serial number. It was very controversial at that time, but we believed that it was a safe technology. Actually, this technology is approved to be used in the United States under the skin. Mm-hmm. So it is totally safe. And what we are doing now, it's trying to move from just an electronic serial number to a biosensing platform. Mm-hmm. So now wearable sensors and everything are more common. And you can see here, this is a technology, just hold it in your hand and just close it to warm it up a little. And now what I'm going to do here is I'm going to do a reading, and you see 26.1 Celsius, an electronic serial number, 26.1, 27.1, 27.2. So like the changes, if you have it there, it's 27.4. But if you close it and start transmitting heat, because your body, it starts picking up.
Oh, it picks it up that fast?
That fast. That's what I'm saying. Like 30.4, 30.8, really? 31.1. So like what we're doing is now exploring how we can add more value. If the implant is going to be inside your body, what happens if that implant not only tells you the electronic serial number, but what if it can tell you if there's an infection or a potential infection, and you can start treating with antibiotics earlier? Or what if we can do just a reading like this and see if the implant is ruptured or not, and you don't have to do an MRI or an ultrasound? So limitations is the sky, but like we believe that this is going to add a lot of value to the
It's
to the
exciting,
patient.
exciting. Yeah.
Yeah.
Okay, thank you so much.
No, you're very welcome.
Och med det vill vi tacka Establishment Labs för deras rundtur och deras vänlighet att vara med på våran intervju av dem. Och det var en väldigt fin upplevelse för oss alla som fick komma och gå runt och titta på fabriken och se hela utvecklingsarbetet för att ta fram bröstimplantat. Om du uppskattar det här avsnittet och tycker att du skulle vilja se mer liknande innehåll, så skriv ni gärna någonting i kommentarerna om vad du vill se. Prenumerera på kanalen, och om du vill så kan du följa mig på Dr. Molding på Instagram, eller Dr. Johan Thorfinn kan du följa också på Instagram. Med det vill jag tacka och önska er en fortsatt trevlig dag.